Remember, no black health, no black history.
Welcome to No Black Health, No Black History, a virtual town hall meeting produced by the 100 Black Men of St. Mary Parish, Louisiana, on the state of black health in our parish. The virtual meeting, a Zoom conference, was held February 17th at 6 p.m. on our Facebook page. The meeting featured Dr. Gary Wiltz, MD of Teche Action Clinic, Louisiana's first community health care center, as well as Brother Walter Kirkland, founding president of the 100 Black Men of Prince George County, Maryland, and a member of their board of directors. He's also a member of the National Health and Wellness Committee of the 100 Black Men of America. Also featured on the Zoom are Ed Jones, founder of the 100 Black Men of St. Mary Parish, Jay Ina, president of the 100 Black Men of St. Mary Parish, and Clarence Robinson Jr., health and wellness coordinator and past president of the 100 Black Men of St. Mary Parish. Now, let's join the Zoom, featuring first Dr. Gary Wiltz of Teche Action Clinic.
You know, I had a brother who had a stroke at 59. Another died of cancer from mesothelioma from working in the shipyards at Avondale at 58. So, I mean, it's a living experience for me and one that I'm totally committed to and passionate about. So when you look at how we as a people, and Black men in particular, the struggles that we have to deal with on environmental racism, you know, all the things that and the stress related to that. You mentioned hypertension. You know, I think some of you have heard me say this before. When it comes to our people, I always like to use the expression, no one can help save us from us, but us. But we have to know what we're dealing with. And you mentioned hypertension, and I'm going to go through, before I even get to COVID, you know, when you look at the biggest killers, the number one killer, and you said it, Kirkland, you know, hypertension, the silent killer. You know, when patients come to me, when people tell me, man, I can tell when my blood is high, and I'm saying, when I start examining them, I say, well, where's that manometer you have inside you? Mm-hmm. Let me see your blood pressure cuff that's inside of you, because you cannot tell when your blood is high. And I didn't put this in the presentation, but let me just give all of you a tip. You're right. The more that we can measure, the more that we can, and we're about to do this. We got a hypertension grant where we're going to be giving our patients blood pressure machines to measure their blood pressure. You asked earlier, how often should you take it? Well, that's between you and your provider, but at least once a day. But it's not just taking your blood pressure. 10% of all blood pressures are abnormal or inaccurate. The reason they're inaccurate because they're not being taken correctly. The correct way to take a blood pressure is you need to be seated quietly for 5 minutes, you know, with your arm on arm's length, with the right blood pressure cuff and your feet on the ground. You know, a lot of folks, when you think about, when you go wherever you get, if you're going in the provider's office, if they're rushing you through there, talking to you and checking your blood pressure, they're not taking it correctly. That is not the correct way to take it.
Doctor, I have to interject. This is so critical what the doctor's saying, because I've experienced it. I'm a world-class athlete. And when they're rushing you through taking your blood pressure because they're trying to get you in and get you out, and no disrespect to you, doctor, I'm sure you don't do that. You're not getting a real number, an assessment. You're getting an elevated blood pressure. So please make sure you talk to them and understand it's really, and the doctor knows this, you really should take 3 blood pressures. You take 3 of them because by then, the doctor knows this, your body is starting to stabilize. But if you're rushing around and you're running around, that's an erratic, and if you're pre-hypertensive already, that's going to put you in a very bad situation with some false information. I want to add that. Sorry, doctor, go ahead.
No. Look, that's exactly what I want to say, but back and forth conversation. So any brother that want to jump in, let me know. The other thing that raises your blood pressure is this thing I'm wearing here, this white coat. How many of you heard of white coat high blood pressure?
I get that.
It's called the power of the white coat. And we have a ceremony for medical students called the white coat ceremony. And I've been blessed. I've done it for Mahari and I've done it for Tulane, where we give a student their white coat. The power of the white coat is a two-edged sword. If you have a white coat on and you tell a patient to quit smoking, 10% of them to quit because you have that white coat on, because they believe and trust you, just that level of trust. But there's 10% of people that are falsely hypertensive because the white coat scares them.
Right.
So, it's the power of the message and the messenger that I want to get across tonight. That's hypertension. When we talk about hypertension, that leads to strokes, heart attacks, congestive heart failure, kidney failure, peripheral vascular disease. So that one killer, that silent killer, is doing more damage than anything else as we talk about. So that was a pre-existing condition that our people had before COVID. And COVID uncovered it. The number one risk factor for COVID mortality was hypertension, followed by obesity, diabetes, and then the sedentary lifestyle and age. But when you correlated the factor. So I'm going to talk a little bit tonight about all those things, and we can have that conversation.
Right.
All of you know this, and I'm particularly as a role model, for all of you. You mentioned being an athlete.
Mm-hmm.
There's a concept that and Jay knows this. We are in the school systems right now, Mr. Kirkland, called school-based health clinics.
Mm-hmm.
We're actually right now in Raintree Elementary and several elementary schools where we're following kids now from K all the way through 12.
Mm-hmm.
So we're trying to intervene in what we call primary prevention. What does primary prevention mean? If you can get a kid to never start smoking, never start vaping, never, become overweight,
Mm-hmm.
to follow a healthy diet, exercise, that young kid, if you can get them to be on a healthy lifestyle, that can follow them for the rest of their lives. Now, in addition to doing that, we do behavioral health, and I included a brochure that as we go through the presentation, I'll put that out there, but we do a behavioral health assessment as well as a physical health assessment on these kids to intervene.
Mm-hmm.
And that part is, we talk about the mental health and stress. There's a condition called ACE, adverse childhood experiences, that kids go through that you can almost draw a line. We talk about from the prison pipeline, these kids that are experiencing these ACE, these adverse childhood events, being exposed to violence, being exposed to drugs, being exposed to things, hunger, the things that will lead to them to a poor outcome. That has to be a part of the equation as we talk about health in America, and particularly health in the African-American community. So I just want to put that out there, that it's not a simple equation where you can fix things right away. Let me go back to COVID. Okay, so we're struggling along. Louisiana, unfortunately, and I think all of you all know this, the United Health Foundation ranks every state in the United States. For the last 25 years, Louisiana is ranked 48th, 49th, and 50th. We flip with Mississippi and Alabama. And the reason that we have been in such a poor shape is because of is multifactorial. One is a lack of resources, lack of access, lack of education, and healthy lifestyles. So a lot of and the stress, all of those things are contributing factors. The model for the state of Louisiana, if you look at our flag with the pelican that's pecking her breast and feeding her baby pelicans, the model of Louisiana is union, justice, and confidence. And I always joke and tell our folks it may as well be eat, drink, and be merry.
Wow.
And our people, they love culture. And I can't tell you how many conversations I've had with patients when they sit across from me and say, well, doc, you got to die of something. Well, not really. So the first conversation I have with every new patient is I recite the prayer of serenity. It's a simple prayer, but at the end of the day, you've got to control what you can control. You can't control your age. You can lie about your age. And then I'm looking at Kirkland, there's something called a chronologic age and then a physiologic age.
Yes.
Now, looking at these brothers, all of you look younger than your stated age. You can't change your age. You can change the physiology of what your age looks like now, your age, but that can't change your race. Part of the problem we're having, and I think you all could appreciate this, is trying to get the data and statistics. Because of 23andMe, people they think they're when the race question comes up on the questionnaire, people are like, well, I just said 23andMe. I got African, I got this, I got that. They're putting unknown on the damn thing, so we can't really measure. You know, as Brother Malcolm said, you know, black blood is the strongest blood in the world. If you know if you're from African descent, then that's going to help us genetically as we study diseases, because we know we're more prevalent than others. But so you can't change your age, race, or sex. Well, you can't change your sex, but we don't do that in a world that community health centers. So the bottom line is you have to control what you can control. And what can you control? You can control the things that you're putting into your body, the way that you're responding, the way that you're taking care of yourself and your families. So I think if you look historically, all those factors have really played a large part into, and that's why I want to applaud the 100 Black men, you know, both nationally and locally, because men historically have been stoic. They've been, you know, resistant to talk about things. They've been resistant to come in and get regular health maintenance and preventive measures. And we call it lost lives, lost years of life. You know, when you look at that, I told you the average life expectancy in America for a Black man is 69.1 years. In Louisiana, it's 66. You know, we're just a little bit better than Alabama. So I'm in Mississippi. And so it doesn't have to be that way. It doesn't have to be preordained. So I applaud everything that you're doing, and behind you, Mr. Kirkland, the wellness empowerment. That is the bottom line. You know, you don't. I can't tell you many folks, by the time they come to us,
yes,
just like he mentioned, you're rushing someone to the emergency room that's now having a heart attack or a congestive heart failure because they had uncontrolled hypertension for 20 years. You know, they're coming in with metastatic prostate cancer where it's already spread to their bones, right, because they didn't get their PSA checked early. They have uncontrolled diabetes, so now they're having a stroke or a heart attack because we didn't control it the way we should have.
Right.
So let me turn to COVID, and then I'm gonna come back to first. I'll open the floor. Does anyone have any questions or any comments before I get into COVID?
Yeah, I want to segue before you get into that, Dr. Wiltz, in relationship to Brother Kirkland. You were speaking about those numbers, and just uniquely enough about, and that's what our theme also is, knowing your numbers. And I think Brother Kirkland had some information as it relates to the blood pressure that we spoke about very briefly, the oxygen level and things like that. That is in our healthcare 2.0 grant itself that we are speaking about. And I think you and Dr. Wiltz will be able to collaborate on those particular items. So we'll throw that back at you, Brother Kirkland, as it relates to those numbers.
Yeah, let me interject. And the doctor's spot on. And you're lucky to have a doctor like this of color in your region, because most of these doctors, as we probably know, are majorities, and they have a different perspective. They're rushing us in and rushing us out. This is truly, brothers, a call to action. And that's military talk, call to action, that we have to wake up. We have to really understand what it means. For example, a colonoscopy. I'm sure the doctor will agree with me. We as African Americans have to start getting checked with a colonoscopy as late as in your late 30s. I'm going to say that one more time. Does everybody know what a colonoscopy is on the line?
Yes, sir.
Okay. It's not a fun thing. It's a disgusting thing. Actually, I hate doing it. I'm in my 60s. I started getting a colonoscopy at 45 and got it every 10 years. And now when I turn 60, I get it every 5 years. It's something that we as brothers have to start doing. And as the doctor said earlier, you know how many buddies I've lost, doctor, with PSAs that it's 5.0, 8.0, and they lose their lives. And it's to a point where it's uncontrollable. Prostate cancer is almost 100% curable. So you gotta, I think after age 50, honestly, the body changes a lot quicker. The body has 3 billion heartbeats in your lifetime. I don't know if you guys knew that. 3 billion heartbeats in your lifetime, give or take, if you make it to 80 years old. Hopefully some of us on this call will make that. So what you're trying to do is prolong those heartbeats. And what you're trying to do is move that needle, as the doctor said, from 66, hopefully to your 90s. How do you do that? Well, what we do, and the doctor alluded to this, what I like everybody on this call to do, if you don't have one, Clarence has it already, is to get a blood cuff device to read your blood pressure. Now you say why this is important. The doctor just said that earlier. It's one of the leading silent killers. And you can buy this on iHealth or Amazon. It's a Bluetooth. You can tie it into your phone and it measures you automatically. And I take 3 blood pressures every 3 days and it pretty much modulates. And to the doctor's point, I make sure I sit down. I almost take, doc, this is what I do. I take like 15 deep breaths just to kind of really, I mean, my wife might have been arguing with me. I might have got into a car accident. You really got to kind of know those numbers. So that baseline information with your blood pressure, everybody in this call should have that. Some numbers to be in mind, the doctor can reinforce this. You know, I used to have 120 over 80, the top number over the bottom number. You know, when I first started getting into this program, I got a little alarmed. I'm like, I'm at 132 over 95. The doc's like, you're 63 years old, man. That's good. That's right. You're okay. Yeah. But you know what I'm saying? But at least I knew that. So that's important. Your blood pressure piece, everybody should get one of these if you don't have one now. It's only $70, guys. So invest in that. Clarence has the kit he can show you. The other thing that's really, really important, we all have thermometers, right? You know, old school, you put them in your mouth. Well, guess what this is? The doctor knows what it is. It's a contactless wireless thermometer. I squeeze it on my head here, 98.6. So everybody should get one of these. I know you have the old school, but get the contactless for your children and your family. And in this COVID environment, the doctor hit it right on the head. We are dying at 2.5, 3 times more than white people, okay? When it attacks our lungs because something about, if we have any comorbidities, which is like COPD, high blood pressure, et cetera, it accelerates. And then if you're overweight, brothers, your waist is over 40 inches. That's another thing. You got to get control of your weight. The doctor's nodding his head. What I do, believe it or not, and I still run as a senior Olympian. I got 6th place last year in New Orleans, and not in New Orleans, in Albuquerque. And I'm trying to be in the top 3 next year in Fort Lauderdale. I look in the mirror, believe it or not, and say, what do I want to work on? And everybody can't do this, but I have a diary and I know all my numbers. So the premise of this program is to know your numbers. And you know what's happening, brothers? Clarence, a lot of brothers are so out of shape. Guess what they're doing? They're saying, you know what? I don't want to know my numbers. And guess what happens? Some of them are dying. Some of them, it's so late. It's metastasized. The cancer's metastasized. And as the doctor shakes his head, it's just too late. I'd rather know if I'm sick than not sick. We're all going to die in this line. These mechanisms with proper diet, portion control, can really put 10 years on your life, okay? The other thing that's real important is to get a pulse ox. Everybody know what a pulse ox is on the call? And basically what this is, you put your finger in it, you can see that, and it gives you a, there you go. It gives you a reading.
Good job.
There you go, it's upside down.
We got you.
What this does, especially in this COVID environment, and I know the doctor's going to talk about this, this gives you an indication of how efficient your lungs are, your resting heart rate, and your efficiency. If the numbers get really low, we have found with doing some of this assessment in COVID, it allows you to say how sick you are proactively versus getting it too late. So please, brothers, invest in a pulse ox, a thermometer, and a blood cuff device as a minimum. There's a glucose machine that Clarence has also. And the last thing is a scale. We have a digital scale that gives your BMI and also your weight. And it's all moved to this thing called MimiRx. MimiRx is it's a Black-owned company out of DC. I consult for them. It's amazing. On your phone, on your iPad, it's your digital passport. You guys have heard this digital passport terminology. You probably heard that in the news. Everything's going to, as the president nods and says, everything's going to like a digital platform. If you're rushing to the emergency room, like the doctor said earlier, imagine have all your information on your phone, your colonoscopies, your blood pressure, your blood type, all in this device versus hard copy paper. That's what we're doing with Healthcare 2.0 and this thing called MimiRx, that you load it into that software on your phone or your laptop. It pushes your information. Once you take your measurement, and Clarence is close to doing this, it automatically populates in MimiRx, which is on your phone.
Right.
And everything is digital. You have your health records right there real time, and you know your baseline. So that's what I wanted to share with you, that this is truly, brothers, a call to action. I don't care where your health is. I don't care if you're 45. I don't care if you're 65. There's a lot of silent killers out there. And I think, and I'm sure the doctor will agree with me, after 50, you lose a lot of elasticity in your vessels, your efficiencies, your taste changes. Trust me, I'm a guy that tried to make the Olympics many times years ago, and I'm intrigued by science. I'll be the guy at 75 trying to win the Olympics, the Senior Olympics. I'm that kind of guy. So I'm real sensitive to when my body changes. You understand? I want everybody in this call to take the same approach. You're all not going to be runners. You're all not going to be Olympians, but you need to know a baseline. Where the heck am I? Am I average, below? Does that make sense? So that's the crux of that. So I want to just, anybody have any questions on that? Does that make sense? Or am I just talking too much?
Brother Kirkland, I want to give you some information as it relates to those items you put up. Yes,
Sure.
As a chapter, we do have all those information, brothers. We do have all those products.
Right.
But if you want to purchase your own, like the Pulsar at iHealth, that's $69, $69.99 for purchase. The Nexium weight scale is $79.99
There you go.
for that. The blood pressure cup is $34.99. When you download the iHealth app, like Brother Kirkland said, it will download your information right into your phone, and it will actually keep up with your numbers. Not trying to sell product, but just trying to facilitate those numbers to us. But yes, if we was in a different environment, brothers, you guys will be weighed in at the meeting.
Yeah.
So we can actually have our numbers where we can really hold each other accountable as it relates to these things. So that's one of the things that we really want to speak about in knowing your numbers and making sure that Brother Kirkland, like you said, Brother Kirkland intrigued me because next year I plan on being at the state meet for the Senior Olympics. So you did convince me to do that after our conversation.
That's
I did look into it, and we're going to do this. And that's the things that's going to keep us actually continue to strive ahead as we're going forward. So any other questions? I thought somebody, Jay, you had something to say?
Yeah, I had a question. I just want to kind of throw it to Dr. Wiltz. Dr. Wiltz, you had talked about blood pressure. You talked about a few things. Just for our listening audience, could you give some maybe some averages or some range that would be kind of normal for an adult? Maybe what your blood pressure should be, maybe what your blood glucose should be, or something. Could you kind of run that down to us for people that are listening?
Yeah, it's a good segue, Brother Kirkland. I like what he said and knowing your numbers. And but I always tease my patients. I always tell them, you don't have to train like you're going to the Olympics. Okay, you need to be the best you that you can be. I've run the Crescent City Classic. It's a 10K in New Orleans for the last 40 years. If I turn this camera around, I got all my little medals up there. But people say, well, how did you finish? I said, I finished first for people born July 7th, 1953, to sit in Helen Wiltz. So it says being the best you can be, your personal best numbers. But to your point, Jay, the goal, and you mentioned something very important, Brother Kirkland. 120/80 has been like the gold standard of blood pressure. And it used to be a misnomer. And I'm gonna give y'all a reference of a brother in New Orleans, Dr. Keith C. Ferdinand, who developed the only hypertensive drug that's unique for Black folks.
Wow.
You look up Dr. Keith C. Ferdinand. It used to be that we thought that as you get older, your blood vessels get stiffer and your systolic blood pressure need to be higher. That's not, we try to keep your blood pressure at least 120/80 to answer your question, Jay. Because it used to be the normal was 140/90. I'm 140/90, you're okay. And look, I must admit, I grew up in that system at Charity Hospital when people say, well, that's not too bad for a charity patient. Well, hell no, that ain't right. That's not normal. We start moving the goalposts and then accepting things that are not acceptable. I don't go to a test and say, man, I wish I could make a 70 on that test. when you go run, you want to be first. So that is the goal, Jay. That's one number. The pulse ox that you mentioned, and let me just say, you should be unapologetic about promoting the device. We call that, I'm telling you right now, we're about to make some serious investments as a company into remote patient monitoring devices, where we're going to be doing scales and temperature. And I'll look at that product because, you know, that is something, if it's a minority owned, I'm looking at some companies right now.
Nice.
So we need to be unapologetic about making sure that, you know, we're supporting our own and the devices. I did go online, I did read with, and you hit all the main ones, you know, pulse oximeter, blood pressure. As far as glucose, Jay, a normal fasting blood sugar without eating for at least 8 hours should be around 99. We measure diabetes now by a number called a hemoglobin A1C, a glycosylated hemoglobin. It's a sugar content in red blood cells, and it tells what your average blood sugar has been for the previous 3 months. I like to call it the video of your diabetes. So when I have patients, and Brother Kirkland is heavily Catholic down here where I'm at. So when patients come in, they make the sign of the cross before we check their blood sugar. And I say, it's too late to pray right now, okay? Because I'm about to check you, and I'm gonna tell you what your sugar's been for the last 3 months, okay? And it gives an average blood sugar. So the normal, and I've simplified my practice. I give my patients report cards. So if your ideal blood pressure is 120/80 and you're coming in at 140/90, then that's a D. You know, so you need to know what the normal number should be. A hemoglobin A1C should be 7 or less for good control. Normal is less than 6. BMI has caused a lot of confusion in our society, because I think we all were used to what was called the average body weight. I think that's what we all grew up with, right? What's the average body weight for someone? BMI is the body mass index, and the best scales. Right. And I don't know if Brother Kirkland has this. He looks like someone about 5% body fat, but there's scales that can actually measure your muscle mass and your body fat content.
Yeah, our scale does that.
Yeah, it does it.
Yeah, but the as a general number, Jay, for like what's a good normal weight? The old school that I used to, quick dirty reference, it used to be a man that is 5 feet tall should weigh 106 pounds, and for every inch above that, you add 6 pounds. And then you categorize it by small, medium, and large. You know, so you give yourself a little leeway on that, but generally that kind of puts you in the range. The other number he mentioned, a waist circumference over 40, puts you at extremely high risk of cardiovascular disease and fat content. So, you know, go ahead, brother.
Well, I was saying that's a simple fix right there, brothers, on this call. If you just measure your waist and you're over 40 inches, whether you're 5'10", whether you're 6'6", that's a lot of issues going on. And it's a wake up call.
Oh yeah.
And what you have to do at that point, real talk.
Yeah.
And I'm getting black on you here. Real talk, you got to kind of cut back on the fried chicken, the collard greens, and Thanksgiving. We all did it. I used to go back 3-4 times, and I wasn't even hungry, Clarence. I would do it because I was conditioned to do it by my family. That has to change, brothers. Because
let me look at Brother Kirkland. We have what we call in Louisiana the killer carb diet.
Oh.
It's fried chicken with potato salad and rice and bread and cake. Oh my God. No vegetables to be found, you know. So that to maintain your body weight, if you weigh 210 pounds, you have to consume 2,100 calories a day to maintain that weight. To lose 1 pound, you have to burn 3,500 calories to lose 1 pound.
Right.
So if you got to counting calories matter. You know, and I tell folks this all the time. You know, I have people say I don't eat that much. Then you ask them how many cold drinks you drink a day. Well, I drink 5 Cokes a day. Well, you know, if you just eliminated that one thing, you can lose a substantial amount of weight. Most of the diabetics we have that are type 2 diabetics, if they lost just 20 pounds, they don't lose 100 pounds. If they lose 20 pounds, they can push themselves back into a normal hemoglobin A1C status. So, again, I love what y'all titled is Know Your Numbers, and but you got to be true to yourself. I mean, that's Shakespeare saying, know thyself and to thine own self be true. So you got to have that Michael Jackson. He never got it right. That man in the mirror moment.
Yes.
Just like you said, Brother Kirkland, you look in the mirror. We've got to own up and face that reality. And I tell all my patients, I can't be with you 24/7, brother. You're your own primary care doctor before me. You're with you all the time, so you've got to make those choices. And look, I know it's hard. I just said earlier, we live in South Louisiana, where all the temptations, you got soul food, Creole food, Cajun food. It's not like you live in Iowa, where you don't have a choice of good, of quote unquote good food. So, but there's a local preacher, I won't call his name, but I love him. He used to always say, when you die and you go to heaven, every day is howdy, 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 and no more goodbyes. You can't eat every day like it's a Sunday meal, and you can't be good all the time. You can't have everything, but you can have just about anything if you have it in moderation.
So what I want to add to that discussion, gentlemen, if you work out, whether you're swimming, walking, Clarence and I talk about this, you can eat. I cheat, honestly, once a week. But the other times I'm cognizant, if I have big hands, I eat the size of my palm. I try not to eat no more than the size of my palm and cut back on the bread. If you cut back on the bread and you drink a lot of this stuff right here, which we don't do enough. Can you see this? Water?
Yeah.
If we drink a half a gallon of this every day, you'll eat less. I'll say that again. You drink more water, more hydration, you will eat less. It hydrates the bodies, the joints. It is the universal solvent. We learned that, doctor, in biology, right?
Right. That's right. That's right.
And I think you got to make yourself, I drink water when I don't need it. And what it does is it just makes you feel better. You eat less and you control your diet. So if we start doing that on a regular basis, and when you get hungry, snack on some fruit, snack on some peanuts, some nuts, versus Twinkies and cupcakes, which is the easiest thing to do. But at our age, it looks like most people in this call are over 40. You gotta take heed, because the doctor will tell you, even our taste buds change. I don't like the same thing I liked when I was in my 20s. So anyway, I wanted to add that to the conversation.
And you're right, and we suffered. If you look at the history of Black folks, they used to call the food we ate poor people's food.
Mm-hmm.
It was actually natural. Those of you who grew up around there, I had a lot of patients that were sharecroppers and worked on the sugarcane fields. They had their little homes. They were descendants of slaves. Then they got to live on the land, had parcels of land where they did their own gardens without pesticides, corn-fed their chicken, and they had a healthier lifestyle, breastfed their children, ate collard greens, cabbage, all the things that brother. So, and then, somehow we got this connotation that's poor people's food.
Right.
That's actually, now you'd see white middle-class women raising chickens, starting gardens, the things that were keeping us healthy. We got away from the things that, and to your point, that is where we've got to get back and be much more cognizant of what we do and how we eat what we eat, how we prepare, and be intentional about how we're going to do. And
we are literally, I'm going to repeat this. We are literally you are what you eat. Dumb as that sounds.
No.
Think about it. You're eating something, the doctor knows this, and you're synthesizing something to go in your mouth that has to go through your body, through your large intestines, through your stomach, and then you have to pass it through your body. The other thing, brothers, that a lot of us don't do, I know, and this is a sensitive topic, some brothers don't move their bowels for a week.
Right.
You have to move your bowels every day, and it's something we don't want to talk about, because garbage in, garbage out, you have to get those toxins out of your body, because we keep in excess, the doctor knows this too, we roughly 6 to 10 pounds in our large intestines. You want to kind of eject all that stuff out of you, synthesize what you need, keep your stomach flat. That's my goal. When I see my stomach bulging a little bit, I change my diet. Now I'm getting old, but a lot of it is just keeping that core flat. Again, everybody can't be Arnold Schwarzenegger, but if you keep those little habits in, hydration, portion control, exercise in moderation, 3 days a week. And I would say, as my dad would say, get your blood hot. When you kick out those endorphins after 20 minutes, I know Clarence knows this, then you're burning more calories than you're consuming. And then you feel, and you know what happens, everybody? You actually feel it reduces the stress. I could have a crazy day, be cursed out by my boss, but if I get a good workout in, I just can deal with it better. And the body synthesizes the stress better. So exercise, portion control prolongs your life, reduces stress. There's so many merit and better, oh my God, better focus. After 50, we lose brain cells after 26, age 26. Did you guys know that? So we lose our focus and concentration. When you get over 35, the wandering brain, it starts to deteriorate. So you need to keep that focus. We lose the focus. People are dying of these Alzheimer's, dementia. That's common in African Americans.
Yeah.
So we need brain food. The other thing you need, and doctor will agree, you need to take your vitamins. In this current environment, gentlemen, I take 1,000 milligrams to build my immune system of vitamin C every day. I take 500 milligrams of zinc every day. I take 500 milligrams of turmeric every day. I take vitamin D, which is a big one. The doctor will agree. We lose vitamin D really quick after 50 for African Americans. And guess what all these things do? You get COVID, it actually fights it off because you're building your immune system, right, doctor?
You can't see what I have written down there. I have everything you just said.
Okay.
All right. We're going to have to go into practice together.
It all connects.
See, Clarence, I didn't even call him Clarence.
Hey, I told you it's going to connect. But look, I want to make this point into to you guys. One thing we could say is on our chapter, and compliment to the gentleman of our organization. For the last 6 years, we've been having free prostate screening in conjunction with Teche Action Clinic and Mary Perkins Cancer Center. Our goal is to always have 100 men tested on a Saturday morning from 8 to 12. Fortunately enough, we've been doing it. We reached 96 on one particular Saturday, but we've been averaging about 55 to 65 men every year. So this year, we go back to the barbershops, one here locally in Morgan City. Now, Dr. Wiltz, we already spec your place out for September of Prostate Awareness Month. We're going to be on the West End, right at Teche Action Clinic, getting these men tested, because basically, like you said, that's a solid killer for men. Sometimes it'd be too late before you even have their prostate checked. But all these particular items are free, Brother Kirkland, for the community. And what it is that we know that we are dying from this particular measure. All you have to do is get the thing done. You have a private test that you can take at home also, with relationship to you doing your private test, and you mail it back in, you get your results privately. They will have doctors on site. Teche Action is giving out blood pressure, blood sugar tests that morning. This is all for men, all for men. So we could hang our hat on that's one way we've been preventing this. Over the last 6 years, gentlemen, you can take this. We've had only 2 men that came back with a positive test. One man came back, and I think Mr. Howard Cassidy could attest to this. And she tracked him down. She said he saved her husband's life.
Oh my God!
Just by having that free test. So preventive is the way to go, you guys. And I don't care what they're saying. We have the information age now going forth, and we're going to do what we have to do. And we continually thank you guys right now for taking time out your busy schedule just to speak to us and hear from the experts. You know, you guys are doing it. One from the inside, one from the outside. And, you know, we just going to collaborate to keep this thing going forward. So, Doc, we really appreciate you guys, and you'll hear more information about that later this fall.
That's great.
Well, we're not done yet. I mean, Brother Kirkland, I'm telling you, I like this dynamic going on here, because just a point of reference. There was a famous song in the 1960s called "You Talk Too Much," That was made by my uncle Joe Jones about my aunt. So we get accused of that in my family all the time. You talk too much, you worry me to death. You talk too much, you even worry my pet. So, but when you said earlier about you are what you eat, and I'm a segue because I know we talked about COVID, but you had to have this conversation first.
Yeah.
There's some there are populations in Africa that have just vegetarian and fruit diets.
Mm-hmm.
And you know what their incidence of diabetes is?
Yeah.
0.
See?
Their incidence of colon cancer is 0.
Goodness.
Brother Kirkland is way ahead of the game because I can tell you right now, I sit on the Governor's Health Equity Task Force, the American Cancer Society. We're about to lower the age for cancer screening to 45, but it should be even lower. We're seeing colorectal cancer right now in people in their 30s. So you are way, and we know people with a high sugar content diet and people that barbecue a lot, that denatured meat, when it comes in contact with the colon, incites metabolic mutational changes. So the diet is important in all these things. So you're right, you are what you eat. And an ounce of prevention, all that stuff your grandma told you was true. An ounce of prevention is always worth a pound of cure. So I'm so glad to have these conversations. And the colonoscopy, when you pick up, you know, I can spend like hours with you all talking about policy and why it matters. President Obama was not a doctor, but his policy saved millions of lives in this country through Medicaid expansion by getting people access to care. We picked up thousands of people in Louisiana with diabetes, high blood pressure, breast cancer, colorectal cancer that didn't have access before he passed Medicaid expansion, and the governor, John Bell Edwards, passed it in the state. So policy matters in addition to, you know, practicing what we preach. Now, Brother Clarence, you can go to the slides. Let me just, I'm going to go through COVID, but I left you all with a lot of references that I think you're going to post on the website. But the first thing I wanted to just talk about briefly was the face of the COVID vaccine. And you say, well, the face of the COVID vaccine is Black folks who are dying. The original face of the COVID vaccine that's going to help us get over the hesitancy that we have is, and I mentioned this before we got on the call. Remember this name, it's easy from roots, Kizzy. Dr. Kizzy Corbett was the lead scientist, an African-American female physician. She's like 34 years old, that Dr. Fauci credited with developing the messenger RNA vaccines that are out there. Then this is a picture. When I go in the room with my patients and I can see that hesitancy and that doubt, and I'm like, man, I don't know, man, they're trying to kill us. You know, remember Tuskegee, you remember this? I flip my phone open and show them a picture of the sister that developed, the lead scientist that developed the vaccine. Right away, that kind of melts away that doubt. You know, I can't always get them all the way there, but just knowing that one of us was on the ground floor developing the vaccine goes a long way. So I want to make that point right off the bat. The first slide set was the public health COVID vaccination brief. And I'm just going to go through that. You know, they had so many, and I'll just talk about the vaccines in scientific terms, but as I'm speaking, I want to let you all know there were so many myths right off the bat. And this is how our people get tricked in food. You know, Malcolm mentioned about you get bamboozled, run amok, led astray. When people were going spreading that Black folks don't get COVID, that was like so people didn't take it seriously in the beginning. And that caused us so much heartache and grief because our people didn't take it seriously right off the bat. I don't know how that got started about Black folks don't get COVID, but that really started us as behind the 8 ball, if you will. Let me just, you can keep it right there, Brother Clarence, that's good. The vaccines are a critical tool to ending the pandemic. So there are 2 different types of vaccines that are out right now. There's one by Pfizer. They're both made from the messenger RNA. And that's the way that we get the body to, we introduce a prototype of the vaccine so the body can recognize it's not a live virus that you can't get COVID from getting the shot. It tricks your body into encrypting a messenger RNA antibody that you can fight it when you do get introduced. If you get introduced to the real virus, you have antibodies to fight it off with. So there are two types of vaccines. There are two companies, one by Pfizer. They're both 2-dose series. That one has to be given the first dose and the second one 21 days later. They made it, but it's not unstable, but you have to keep it like the freezing requirements are a challenge. So once we get it here, we have, on average, we have 3.5 days to use it. And if you don't use it, then it's no longer effective. So it's 95 to 98% effective, and it's proven to help prevent folks from going into the more serious disease and winding up on the ventilator and death. The second one was Moderna. And let me just say, the clinical trials on both of these vaccines were over a year. Trump, they misnomed the whole process when you call it warp speed. You know, warp in itself is a term that's derogatory. It's like warp means it's not right. You know, and I think a lot of people use that unfortunate term. The technology that was used in developing these drugs have been around for like 6 years. It wasn't that they created it right away. So both the Pfizer vaccine and the Moderna vaccine are 95% effective. So I want to make that point that there have been no reported deaths. Side effects, I don't know if you've had yours, Brother Kirkland, if you've had your vaccines.
No, not yet. I'm not at the age yet. Not yet.
Okay, well, what we started off with the healthcare workers first, okay? The front line, particularly those in the emergency room and those in the hospital settings. So we did those frontline workers, and then we moved to the essential workers and the people that were having the most exposure. Then we went from 70 and above. Now we're dropping it in Louisiana down to 65 and above. So we're working our way down a critical list. You can go to the next slide. So that talked about the vaccine development and the personnel. You can probably go to the next one. And look, all this material, and there's a lot of material that has basic scientific backgrounds about vaccine safety and the development. But what I want to concentrate on right now in the few minutes I have left, which is critically important, and it's not being publicized the way it should. So please, all you brothers, if anyone that you know, family or friends, get diagnosed with COVID, and you are in a category that you are not, I'm trying to get to that slide. The drugs are approved for use. Let me just get to it so you know what I'm talking about. You get diagnosed with COVID, you have these comorbid conditions, hypertension, obesity, diabetes, you're a certain age. You go to the emergency room or urgent care, you get diagnosed, but you're not sick enough to be hospitalized. That pulse ox that you mentioned earlier, that's critical that you check your oxygen level. But we have treatment available before you get sick enough to have to go into the hospital. And people don't know about it. They don't know about it the way they should know about it. It's called monoclonal antibodies. It's an infusion cocktail. If you're diagnosed and within 3 days, if you feel fatigue, have fever, muscle aches, you call and you can go, and I gave that in a packet of information that I'd given to Brother Clarence before. You can go in and have a 1-hour infusion. It's the stuff they gave Trump when they took him to Walter Reed. Yes. You get an infusion. It's a cocktail of these antibodies, and it can prevent you from going into respiratory failure and hospitalization. I've had several patients that I've sent 24, 48 hours after they got diagnosed that still were feeling bad, got the infusions. Within 24 hours, they were asymptomatic. You do that along with what Brother Kirkland said, vitamin C, vitamin D, zinc, controlling your blood pressure, controlling your diabetes, then you can lower your risk of hospitalization and death. There's another thing called convalescent plasma serum. We did 1,000 tests. I think I don't know if Jay, if y'all took part of it, but we did 1,000 tests in St. Mary Parish in a study we did with the National Minority Quality Forum and Harvard University, where we actually found people in the community. We checked them to see if they had convalescent antibodies. Some of them have been exposed to COVID and their body developed natural antibodies to COVID. We had them come and donate their blood because you can get, if y'all know someone that's in a hospital setting that's deathly ill, that they're talking about putting on a vent or their condition is deteriorating, you need to make sure that those doctors, you ask those doctors, those healthcare professionals, what about convalescent plasma serum? It's plasma that has the antibodies in it from people that had COVID that developed natural antibodies. That too can be life-saving. We've had the New England Journal put out the report. People that got that plasma serum, it's almost miraculous. Within 24 hours, they went from being on death's door to turning the course. So remember, outpatient monoclonal antibodies, and it's all free. But if you don't ask for it, they won't tell you. A lot of Black folks are going to the ER, they're being turned out, turned away, and not even being told about these treatment options, that one in particular. And then when they get in the hospital, they're not really being aggressive with the families or treating them sometimes. You know, our people have been dismissed for such a long time that, you know, you don't know what to ask for. If you don't know what to ask for, then they won't tell you. So I'm telling you, and I think, Clarence, I gave that to you. I also gave you a lot of stuff about stopping the spread and how to mask and those sort of things, but I wanted to make those 2 points.
Dr. Wiltz, I think Ed had a question. Go ahead, Ed.
Doc, the infusion you're talking about, that's being handled at Iberia General locally, right?
We have it at Franklin Foundation.
Okay, I didn't know that. So.
There's a list I sent it. If I didn't, Clarence, I'll get it to you. It has the list of every hospital in Louisiana that has it.
Yeah, I didn't get that.
Yeah, I have it. It's a link you can go to called monoclonal antibodies infusion. I know when I first learned about it, when I called Franklin Foundation, they had it sitting in a pharmacy for a week.
Wow.
They didn't even tell folks, and I was sending until I started making the inquiries, and then we started sending people to get it.
So, Doctor, what is your suggestion?
Is that it's Frank? I didn't mean to cut you off, Clarence.
No, go ahead.
So, do they have it on the I guess the east end of the parish, like Austin St. Mary?
Austin St. Mary didn't have it. I don't know if they've gotten it yet, but the last time I checked, they didn't.
Okay.
Now New Orleans has it. You can go online and you call them and you make an appointment. You come in and they'll give it to you, but you got to ask for it. And you can self-refer. You just have to go there with the diagnosis of a positive test, and there's a checkoff list of criteria. But the criteria is it's one based on like weight, if you have pre-existing conditions, hypertension, age, and then if you're having symptoms of body aches, fever, or malaise. It's called a monoclonal antibody infusion.
I'm familiar. My mother had it, so I know what you're talking about.
Yeah, I don't know if she had to ask for it because they don't always offer it.
Trust me, we asked for it.
Good for you, because there's several. There are a lot of it could prevent you from having to be hospitalized, shorten the course. We're also working on clinical trials right now that I'm trying to get our folks to get involved in on antiviral drugs that can treat COVID. Just like we have treatment for HIV/AIDS, the drugs are being developed right now, and we're hoping that we'll have those later this year. Because once you develop, just like antibiotics can cure a bacterial infection, once we get these antivirals, that's going to be another tool that we can use to get this thing under control.
I had a question, Doctor, in regards to that. What is your suggestion as it relates to that piece of information you just stated the last 5 minutes? How do we get that information, which you just stated, out in our communities to make it?
Put it on YouTube, put it on. I've had this conversation with Howard. I just, every time I get an opportunity, I'm on these national committees and state committees, and I keep bringing this up because they keep everyone is pushing the vaccine, which is what we should be doing. But in the meantime, you can get those infusions and it can prevent you from progressing. And until we can get enough vaccines into enough of our people, and there's a maldistribution of vaccines, and our people aren't taking the vaccine at the rate that they should be. And I can tell you what's going to happen. If our folks pass up, they're going to go to the next in line.
Right.
And so I don't want our folks to complain, well, white folks are taking it. Well, hell, if you're passing on it, but I can't sit on it. When we get that Pfizer, when I got angel doses or extra doses, I got to put it in somebody's arm.
Mm-hmm.
So we create a waiting list of ready people to come in and just, if I call you, you know not the time, not the hour, you better be ready because we can give you the shot, if you're on that waiting list. So, but I'll get that information back to you with the LDH website that lists the hospitals.
Well, we will be posting that information on our Facebook page, Dr. Wiltz. We really appreciate that.
Okay.
So.
Then the other things I put on there, how to safely wear a mask. Our people are not wearing the mask right. They are, it's not covering their mouth, their noses, then they're not wearing the right type of mask. And that goes through the whole process of double masking. We have the variant that's out there now. The vaccines that are currently available are still effective, but we're all going to need a booster shot probably before it's all over. Yeah, this is a good little illustration of what to do and what not to do. Of course, it goes without saying that we should not gather in super spreader events, socially distance and wash your hands. That LDH website is a great one that can give you lots and lots of information. So let me just recap. Brother Kirkland said it in the beginning. The rate of infection in African Americans is almost 3 times that of whites. The death rate, mortality rate is almost 3 times, and the vaccination rate is pitiful. It's not nowhere near where it needs to be. So President Biden just allotted some vaccines for us in community health centers. They're going to be putting a lot more into in mobile units. They're going to be putting a lot more into. Thank God we have somebody that now has a plan. When you're president and you say, when I'm president, like he is, he said, you have to wear a mask in all federal buildings and properties. If the governors will come behind him and say, you have to wear a mask in all state properties and buildings, and then if the mayors would do the same, it's a trickle effect to get broader coverage. If we had uniform policies on school openings, vaccinating the teachers, you got to keep this, and the bus drivers and essential workers. Mm-hmm. We've got to push that down to get our folks protected. But I say that at the beginning, policies matter, and the policy makers matter. And I can't emphasize that enough. I'm just delighted that we have somebody in the White House and people that have common sense, compassion, and are letting science drive this bus. And I really do feel that we will get out of it if we just do the simple things that we can control, and then take advantage of the things that are out there. That's the message I want to make sure that our folks know. Control what you can control.
So another thing I want to add, Clarence, to the doctor's discussion, there's a company called Novavax right out of here in Baltimore, Maryland. They're doing clinical trials specifically for us, Novavax, and that should be coming out in the next couple months. So I think if you look at what we have, Pfizer, I don't know, we have this echo now. We got Pfizer, we got Moderna, and
Johnson's
coming out in 2 weeks. Novavax, and there's about 5 more. I think we'll get the herd immunity, which means 70% of people be vaccinated. Right. I think, in my opinion, doctor, by the end of the summer or the fall, because they're a little behind already. And that's with 1 or 2 shots. So look at that 21-day lag period. Johnson has 1 shot, and it has a really high efficacy rate too. But I think, to the doctor's perspective, What we can do now is wash our hands and wear, you know, when I go to the gym, Clarence, I wear 2 masks. I wear the N95 under it, and then I have one on top of it, the one you pull up. And I wear gloves so I can't touch my face. And then I have to wash. So there's ways to get around that. But if we do those kind of precautionary things, take our vitamins, keep socially distanced, and then look out for our family and limit our pods. Pods means your inner circles and where you go and not go. You can't trust Joe Schmo. You don't know where he's been. You don't know if he's been infected, right, doctor, or asymptomatic, et cetera. These are the things we still have to practice, I think, for another 6 months, in my honest opinion.
I would agree with that. No, I've said the same thing, and you've done your homework, and that is where we would. That's if we do those things, we can get back to some sense of normalcy.
Yeah.
But then it gets back to the original conversation we had tonight.
Mhm.
We were unhealthy as a people before this.
Yes.
COVID exposed that.
Yes.
So you can't not continue to deal with the problems that have been killing us way before COVID.
And guess what the majorities are saying? And I'm not being racist here.
Mhm.
We're already behind the curve in finances, education, health. We got to take a real look at what a call to action. Take control of our health. This is not a game. And you saw, I live literally 10 miles from where you saw that Capitol get torn up. We're in a different world, brothers and sisters. If there's any sisters watching or listening, we as minorities, this should be a wake-up call all the way around, right, doctor? All the way around in terms of our health, economics, education. We got to take real ownership and be more fact-based versus conjecture. If you're more fact-based, like the doctor said, and you can go into these ERs and knowing about the infusion, knowing about these things, guess what happens? In my life, I've worked as a consultant in the healthcare field. The doctors talk to you. See, white people do their homework. White people know stuff when they go in there. These doctors, not you, doctor, are condescending to us because they don't think we have the intellect to even understand what they're talking about. Do you understand? So we got to get more, we got to heighten our sense of intelligence to know, like Brother Jones said, I think he said his mother get the infusion. You got to take those steps and be proactive. Because if you don't, you're just a damn number. Get them in, get them out, rush the blood pressure. So what? I'm not going to use that N word, but so what? They don't really matter. I mean, some of them think that way, y'all. I mean, I hate to be so drastic, but this is what we have to kind of up our game all the way around. So I'm not a racist. If anybody's listening, I'm just trying to keep it real.
No, it's an inherent bias, you know, and I call it population parity. If we're 16% of this population, whatever our percent is now, 13%, then it's not an unreasonable expectation that 13% of all the doctors in America should be Black, right?
Yes. Yes.
We're 4.5%. Same is true for law, education, but we're overrepresented in the criminal justice system. Something's wrong with this equation when we're overrepresented on the worst things. So, the people who try to put a bad name on affirmative action, well, call it population parity. All we're asking for is to be reflected in society and what our numbers are.
And these folks are afraid. What you saw and I know this is not political, Clarence. You saw what happened at the Capitol. Folks are getting afraid. It's all about power. Come on now. I'm in my 60s. It's all about power and someone else taking my power away from me, and I'm afraid of it. So it's resources, and these health discussions are so critical. It starts here, but it also starts with our children and the next generations.
Exactly.
I know we're getting to the end of the hour. It's 8:15. Clarence, do you want to move into the Q&A? Or?
Yeah, that's what I want to ask. Anybody have any questions? I think going through the process, I think a lot of people got some questions out. If anybody have any Q&A questions, submit it in the chat or come off. I can take you off of mute so they can hear your voice. Just let me know what's going on.
Gotta have questions, brothers. Come on.
Clarence.
Go ahead, sir. Cedric.
Hey, Cedric Wilson. I just want to say I was listening at Doc, and I mean, the brothers know it just hit home, Doc, when you were talking about going to the hospital, and it just shoving us off. The brothers know my wife just got out.
Cedric?
You muted us, Clarence. Unmute him. Hey, Clarence, unmute yourself. Go ahead.
You can hear me?
Give me
Yeah,
now.
I can hear you. Go ahead.
Okay, so she went to the hospital out here in Louisiana at Thibodeau General. We spent from 11 a.m. on a Sunday morning till 6 p.m. on a Sunday night, feeling bad, can't breathe, walking up and down the hallway, still can't breathe, sent her home. All they did was up her Decagon to 50 milligrams, sent us back home, just attesting to what doctors say about they shove us off. Sent us home. The next night, my wife is laying on the floor, can't breathe, took her to the hospital in where she lived at around Gonzales, Louisiana, spent 9 days in the hospital. And a doctor was like, I can't believe they sent you home feeling like this here. Just to attest to what Doc said, they just shove us off. And she didn't have to be on a ventilator, but she's sitting right here next to me listening at the whole call and just shaking her head and saying, that's how we were treated. As you know, like, and didn't know about the extra vaccine, you know, things that could have been done, but you know, she fought. And then they stuck her in there, you know, and people can't visit you. They act like you're mental, act like something's wrong with you. And one time she had to tell a nurse, I'm not in here because I'm mental. I'm very intelligent. I'm in here because I have COVID. So don't treat me like I'm mental. Just a little test to say, you know, but thank God she's sitting right here next to me, listening at everything y'all saying, but
God bless her.
It's real.
Yeah,
I just want to just say that, you know, it's real.
Look, I know it's 100 Black men, but I can tell you Black women have been dismissed with cardiovascular disease out of the ER, you know, like they don't have heart disease. It's the #1 killer of women.
Yes.
And Black women in particular. Louisiana is a horrible, I just, before this call, I'm trying to recruit a young African-American female OB to Franklin. We have one of the highest mortality rates for women in childbirth in the nation because they go to the emergency room postpartum after they've had their babies, preeclamptic with high blood pressure, and they're being dismissed. And I know, Jay, you know someone personally, you know, that so it's systemic. When Trump is saying, well, I don't know what systemic racism is, well, hell, we know what it is. You know, we see it every day. And and to your point, Brother Curtin, that you got to play on all the fields, because it is that systemic. You know, and if we don't educate ourselves, you know, I'm sure I would be surprised if you didn't. We have what's called the patient portals, where you can have access to your records. That remote patient monitoring device, you can actually have it imported to your physicians or your providers, part of the medical records. You know what? I tell my medical students, high tech is the greatest thing in the world, but if it's not married to high touch, when you marry high tech and high touch, then you got an unbeatable combination. And that's what we need. And that's what we bring, I think, in the African-American community. You know, you're not just a number. You know, if you know, the big catchword in medicine this day is the social determinants of health. I can tell you right now, people that are in the, that are coming into our office right now, you know, their biggest worry is keeping their lights on, keeping the electricity on so they won't freeze to death. In the summertime, they worried about heat stroke and keeping the air conditioner on. And you say, well, what does that have to do with medicine? It's everything in the world to do with medicine.
Doc, I have a question. And for Doc and for Mr. Kirkland. You just mentioned something, high tech and high touch. Knowing where medicine is going, telemedicine, telesurgery, They're talking about all kind of things where you can do remote surgeries in 10 years to where the doctor could be in his office and the patient can be in China. Knowing that's coming, that's an inevitable with 5G and all this stuff that's coming. Knowing that, how do you think that's going to further expand the digital divide or the divide with medicine and people of color?
You're absolutely right, brother, because we don't have broadband access. Our people don't have smartphones. So there's a gap right now. You know, on text messaging, you know, we have all the vaccines that we administered the last few weeks. We're having to try to call our people and they don't have texting available. So we can't, you know, text messaging, reminding people to check their blood pressure, reminding them to check their blood sugar, reminding them, you know, to eat right, and those messaging, but then recording those things that we talked about. You're right, that unless we address that now, and I'm just telling you this as an organization, and I'm sure Brother Kirkland knows this already, you know, and I'm not being racist either, Brother Kirkland, but there's such a thing called white guilt.
Ooh.
There's a company, I want you to write this down. There's a company called Quest Diagnostics. They're one of the biggest laboratory countries, and you write this down. So after George Floyd, these corporations now all of a sudden, because Trump was pushing, don't teach cultural sensitivity. Remember, those of us in the federal, you can't do that. You know, these corporations now started putting out programs to be more intentional in the way that they treat minorities, right? So this brother that's in Jackson, Mississippi, who's with Quest that we did the study with, he said, man, after George Floyd, the company president came and said, put together a program that I want to do something for the minority community. So he said he went back to him and he brought him a proposal, a $33 million proposal. And the guy said, I'm rejecting this. He said, it needs to be $100 million.
Mm-hmm.
So there's a lot of corporate guilt and goodwill out there that we could use to our advantage to help, like with the devices you're talking about. They're companies that in the private sector that are, even if the racist politicians don't get it, these corporations get it.
If I can add, Ed, and you're exactly right, Ed, in terms of technology and even the skill set, but there's companies, Jeff Bezos' ex-wife, she got $180 billion. I'm going to repeat this, 180 billion, not million, in her divorce settlement. I'll tell you how much money they have. She's already donated close to 100 billion to historically Black colleges. 25 million went to Bowie State here in Maryland, Morgan State in Maryland, and then I think down in Atlanta, Clark, and so on and so on. So to the doctor's perspective, there is some white guilt going on, and we have to leverage that, Clarence. We have to find ways through the 100, which we're trying to do. Pfizer gave us a $250,000 grant for COVID that we're using with some of this stuff we're doing now. So I think we got to find politicians, high level people here in DC to say, okay, now we have this racial divide and we know Blacks are dying at 3. We know all that. How do you bring that technology and the funding? It's all about resources. And that's what we're lacking, as the doctor nods his head, Ed, is that I've been in this world with the medical technology. It's phenomenal. Telemedicine is rocking. It's good stuff. But if you don't have broadband, you don't have smartphones, and especially as you go into the lower income parts of the country, it ain't going to work. It sounds great. It sounds like a nice hype story. But if you ain't pipe it in there, you ain't getting any information. So I think now to that white guilt, and that's what I'm running after, is trying to find these people to drop 50 million, 20 million. So we can support Dr. Wilson, his area, what he's doing, and give him additional money or grants. That's how we change the paradigm.
Right. My question is this, and I appreciate that good question, Ed. And Dr. Wiltz, we overlook a lot of things in our own communities. Where is the mental health status with all this going on right now? Because a lot of people are dealing with a lot of things.
Yeah.
From your clinic's perspective.
I had them send you the brochure, but I'm saying Teche Clinic, we are mandated that we have to provide behavioral health as well as dental and medical services. I have a young lady working on a program right now called Mental Health First Aid. Mm-hmm. you know, and this brings in the law community, and Ed Jones, you can appreciate this. The police are not equipped to deal with people with mental and behavioral problems. And, you know, when you call, and our people, well, what you gonna do? I mean, if my brother, if someone's acting quote unquote crazy and they're out of control, you know, I'm gonna call the police. If the police aren't trained, they're gonna take and subdue. They're not gonna try to de-escalate. They're not trained to do it. So but it starts earlier. Like I talked about the adverse childhood events. I have a program that we're trying to introduce. Carla Vappy actually is going to lead our effort with this. She just went and got additional training. It's called Mental Health First Aid. We had a panel discussion earlier late last year, where we had the Chief of Police, Morris Beverly, and some of the law enforcement community and some of the other folks, where we're trying to get together a team approach where we can and get the coroner's office and the public to understand how to deal with mental illness before it gets to that crisis point. You know, and so to your point, we did it in the school system in St. John. Jay, you would appreciate this. These kids that were acting up, quote unquote, and they're mostly our kids, then when they would act up, they sent them straight to alternative school. Straight to alternative. So what we did was we came in and Jones, we put together a diversion plan. Let's put a treatment plan together where we can treat their behavioral problems. And if they successfully completed, then they don't have to go to the alternative school. And we did that with a bunch of kids, and it prevented them from having to go there. Now, we haven't been able to systematize it the way that I want to. And I've had my own problems with the school board here in St. Mary, as so you all know, that trying to get them to, you know, let us help our people in the way that we can. But to your point, Clarence, I'm very much aware of it. We do have some initiatives that we're going to be trying to spread out there, but it's huge. These kids are traumatized. I mean, everyone's traumatized, but the kids in particular, I don't know if you saw the town hall last night with President Biden, with the little girl was like, the children, they feel like that little girl expressed, I'm afraid of getting COVID and dying.
Right. Yeah. Exactly. And Clarence, what's happening from a Black perspective is that depression, suicides up 30% between, and I've done some research on this, between age 18 and 18, 30%. And you talk about isolation and dysfunctional relationships. If we have limited resources, we don't like where we lived before COVID. Can you imagine domestic violence, suicide are off the charts? So this is why all this is intertwined. And I don't know what it takes this is a wake-up call. This is clearly a wake-up call for all of us as a people to say this has to stop. So stuff like this, passionate doctors like Dr. Wiltz, is the beginning of the process. And when we implement things and we start to change the paradigm and move the needle in a positive way. But information is clearly powerful. The more you know, and I know that sounds like a corny statement, but the more you know at any level, the more powerful you can be to treat it, get ahead of it, and change your life. But these kids, I'm the chaplain at Bowie State University. It's the third oldest historically Black college in the country. These kids are just, think about it, they don't have an outlet. The track team shut down. They can't do what they want to do. They don't have anywhere to go. We feel this way as adults. Can you imagine, Clarence, when you were in college? I was a track guy. I couldn't get on the road and travel to try to compete. I would lose my damn mind.
Exactly.
So it's a very strange time we live in that I hope one day, Clarence, we can have a drink at the bar one day, or maybe hit some golf balls and say, hey, remember that time, COVID-19? Because this is a really, really strange time.
Really is. Really is. Any other closing comments? Any? Because we right at an hour and a half straight up.
Well, I want to thank everybody. Dr. Wiltz, I want to get your phone number, because you and I have to kind of connect, because you're an anomaly, brother. You're a different dude. You care, you're passionate, you're doing good work there. I want to connect with you. And Clarence, thank you for your leadership, and the president and Ed Jones for forming the chapter, and all the other brothers. But thank you and I hope I brought something to the table, and just thank you for allowing me to spend some time with you guys.
Well, we look forward to get back on the platform again, brother. We're looking forward to it. You can't disconnect from us. So, Dr. Wiltz, any parting shots right there?
Just thank you again for the opportunity. Unfortunately, what happens with me is you get involved in so many activities, there's so many things that I want to do and would love to do and want to make available as a resource, for folks. I have resources here that I told my wife, if only we were 20 years younger, if only we had more time. But that's the one race that you tracksters can't ever win. It's for the time. But Clarence, and I just want to make it available to all of you. We will support the 100 Black Men. We have lots of resources. I was president, the first Black president of Tulane Medical Alumni Association. I was the first Black chairman of the board of A.T. Still, the oldest osteopathic school in the country. Wow. I have lots of resources if our kids want to get into careers in medicine. We have a hometown scholar program. If we write a letter, they're guaranteed an interview into a physician assistant school. Very nice. I'm trying to partner with the school board now to try to start back the LPN school and the technical colleges. There's so much that we would love to be able to be engaged with to help, as I said in the beginning, help us help ourselves in a way that only we can, in a way that only we can.
Well, we appreciate the partnership, and we're going to continue to stay in support with you guys. Like I said, more things coming down the pipeline with that. And we know exactly where you guys at. Your team is awesome, Dr. Wiltz, and we know you're busy, but thank you for taking time out your busy schedule.
My pleasure.
President Ina.
Just got on mute. Can you unmute him, Clarence? Okay,
yeah. I mean, I don't have a whole lot to say. Dr. Wilson and Mr. Kirkland, we appreciate your time. Dr. Wills, we definitely gonna be getting with you coming up here in the near future, so we can kind of see, how we can partner and what we can do to expand healthcare, whatever type of initiatives we can to try to help our community and be at the forefront of providing, top-notch service to our community. Community service means it has a lot of different areas, and we want to be a lead organization in our community, especially when it comes down to serving our people and serving our community, making our community better. But man, Doc, we work together, on quite a few occasions. You do a phenomenal job. We appreciate what you do, Mr. Kirkland, man. It was a great opportunity to meet you and visit with you. You're a brother that's full of information, man. I respect everything that you said, and we're gonna have to get together again and kind of talk and see how we could partner up in the future and what we could possibly do. But we appreciate your time. We appreciate everybody tuning in, and we're gonna have some more stuff coming down the pipe here in the future, so stay tuned.
Yes, stay tuned. In the next 2 to 3 weeks, we're gonna be back right at you guys. Mr. Kirkland already know, as far as the platform, we got to have at least 2 more presentations. So we'll be going forward, and we'll be connecting with your administrative team, Dr. Wiltz, to get some more of your colleagues on this platform to have that information out there. Also, we will post the information on our Facebook page, and this program is being recorded, so it will be back out there on the platform where people can go back and to refer to it. So with that being said, if any other questions, we just pray you guys stay safe. We still have some inclement weather in our area. Praying for your families that they continue to be safe, and praying for the Teche Action Clinic and also the 100 Black Men on that East Coast up there, Brother Kirkland. And we look forward to hopefully next year this time we'll be preparing for that engagement, brother.
And what race are you going to run, Clarence?
200.
My man. I'm going to do the 200 and the 400. Yes, sir. And we're in different age categories, so I won't be
we ain't
racing
going to worry about that.
I'm an old dude, but we're going to be in Fort Lauderdale trying to get it done. All right, guys.
All right. Have a good evening, everyone.
God bless you.
Good night, everyone.
Thank you all. Have a good night.
Awesome meeting, Clarence, President. Good job. Bye-bye.